Good morning, it's Dr. Garrett. Today I want to talk to you a little bit about peptides. I think that peptides are starting to become a buzzword and everyone thinks that this is a new thing, and it's not. Our bodies have been creating peptides for centuries. So a lot of times people will start to hear these words used more often and they think it's something new, but this is something that your body can stimulate on its own. Occasionally, if you are functioning suboptimally, you may have to use a lab-created or a lab-derived peptide to help the body work better. But peptides are used within our body for all functioning. We need these peptides. These are what's going to help with joint repair, to help with skin aging, to help with tissue healing, regeneration of different things, to help your gut to be able to cover the sugars that are taken in. But it requires a healthy, stable body in order for these peptides to work best. So let's talk about what this is and where these can be used. So peptides, these are a cluster or a clump of anywhere from 2 to 50 different amino acids. And we know that amino acids are the byproducts of certain protein breakdown. Now these amino acids will clump together and then they'll be utilized within the body for different things depending on what the need of the body is. However, you have to have a good gut microbiota, you have to have the right fuel in there, you have to have the right amount of nutrition and the correct percentages of nutrition in order for your body to create these peptides correctly. So these peptides are going to make the body work harder, or they're going to help facilitate or accentuate what is going on. Now, this could be like a sermorelin or tesmorelin, where it is going to stimulate the release of your own body's human growth hormone. Now, human growth hormone, I think, is misnamed. It should be human repair or human recovery hormone, because this is what's going to help to repair the body. It helps your body get rid of toxins that it doesn't need. It helps to stimulate the repair of tissues, organs. It helps the whole body do something better. Now, there are other ones like our GLPs that'll help with weight loss and satiety, so you're feeling fuller longer. There are ones that are going to help with skin and collagen like matrixyl or copper, and these are going to help the skin look better. So each of these are going to cause the body to work harder. In order to synthesize them correctly out of the gut and out of what you're eating, you have to make sure everything is in balance. When it's unbalanced, then these are when we're going to need a little boost or a little help to get to where it needs to be. So some of these are going to be lab derived, especially when our gut microbiota or our body is functioning suboptimally. So where can we use these peptides? In regenerative medicine. And you know, this is what I love, because I love healing the body. It is one of my favorite things to do. So in regenerative medicine, we're using things like sermorelin or tesmorelin for that human growth hormone. We're using things like BPC 157 to help with inflammation in the joints and tissue healing and regeneration. We can use these in terms of medications that'll help with libido, to help stimulate the body to work better. And this is what we really, really love to do. Again, tissue repair. We can use this for beauty. So for things like matrixyl, this is going to help with the skin and to make the skin more beautiful. Copper substances make the skin more beautiful. Health, and this is like the GLP-1s, like the medications that help with weight loss. These are going to be used to help to stimulate satiety in the body, so you're feeling fuller longer. It's going to help your body get rid of the excessive sugars so that you're not storing sugar as fat. And then overall wellness. We have a lot of them that are just for overall wellness and just making your body better. Some of these can elongate the telomeres, and what that'll do is that is going to help structure your DNA and strengthen that DNA chain. When that DNA chain or those telomeres start to become shortened, that's when you're going to end up with cancer. And so some of these will help elongate those so that you don't have to worry about changes in DNA changes, which is going to cause a cell to do something abnormally, which becomes a cancerous cell. So now let's talk about how the prescription ones work. Again, we can synthesize some of these from our body, and I'll tell you how to do that here at the end, but let's talk about how the prescription ones work. Some of them are going to stimulate hormone release. And so they're going to tell the body, hey, I need you to release these certain hormones so that the body can work better. Some of these are going to stimulate an immune response so that the body is going to flood a good army of immune support to that area to heal the area. Some of these are going to help with metabolic function so that your body is going to work as the machine it was designed to be. Some of these are going to reduce inflammation. Some are going to help with insulin sensitivity. Some will stop viral replication. Some are for skin health. There is one, it's kind of getting a little bit more steam. It's called the Barbie drug. And what this does is it stimulates a production of the darkening of the skin cells. So you kind of look tan, which I'm not a super fan of that one, but that's how these ones work. So now, what are some of the ones that we use in healthcare, especially in regenerative medicine? We've already talked about the tasmorelin and samorelin. This is going to reduce an abdominal body fat. We've talked about the CJC 125 and IPA. This is stimulating the growth of hormones or growth hormone release so that your body can repair itself. We have the epithalon, which is going to help with anti-aging, and that's the one that's going to elongate those telomeres. KPV. Now this one we have in combination with BPC 157 as a supplement. And what this does is this helps with inflammation, promotes wound healing, will help to heal the tendons in the gut. So not only does it work for people who, let's say, have a meniscal tear or Achilles tendonitis or plantar fasciitis, but this can also help with people who have leaky gut. And so I like to use this combination with those patients. Copper, this is a skin repair and anti-aging. Now, a lot of people know about the weight loss GLPs, or the GLP-1s. This is the semaglutide and tirzepatide. There's a new one that's coming out, and it is still in the experimental phases for weight loss. Here at the office, we can get you a prescription for the PT141. This is a libido enhancement cream that you're going to be using. Argireline is going to reduce wrinkles. Matrixyl, this is going to help with collagen stimulation. I absolutely love Matrixyl, and we actually use that in a topical form. We get this from Alumier, and this is a serum that you're going to use on your skin every evening. It has vitamin C and E in here, and this serum you're going to put on your skin, and it's going to stimulate collagen stimulation. A lot of these medications can be used together and in conjunction with, but again, if we can get your body to stimulate the production on its own, your body is going to be a lot healthier and happier. And sometimes we can add these in as a little boost to get you to where you need to go. But you need to be making sure that your body is working optimally. So you need rest, relaxation, a good gut microbiota, and I've got thousands of videos on leaky gut and gut health. You need to make sure that you're drinking plenty of water. I don't think people realize the importance of water. We need free amino acids. Now, I actually use a supplement for amino acids because I don't eat a lot of meat. Now, while I get a really good source of protein from my nuts and my seeds and my oils, sometimes I need a little additional, and I can feel when I'm feeling a little bit more tired and a little bit more fatigued and my skin's looking a little rough, that's when I need those free aminos. Polyphenols. These are things that you're getting from your cup of blueberries or blackberries or strawberries or raspberries every day. It's what you're getting from your green tea. It's what you're getting from those beautiful antioxidant rich foods. Short chain fatty acids. This is going to be coming from the breakdown of different things in your gut. So making sure you have plenty of fiber on board. So eating a cup of beans per day, whether that's some black beans in your salad, which is also good for iron production, or eating some hummus with some carrots and celery or cucumbers. Now, once the gut starts breaking these down, then you're going to notice more improvement. If you need a little additional support, usually adding in some fermented foods really helps, and that'll help restore that gut microbiota as well. So those are going to be things like sauerkraut, kimchi, kombucha, kefir. Making sure you got plenty of pre and probiotics. Prebiotics are going to be what feeds the probiotics so that they go in there nice and strong and they can heal and take over the bad. So it's kind of boosting the army before it gets to where it needs to go. And these are going to be things like leeks, garlics, onions, asparagus, artichokes. These are going to be the prebiotics. Then probiotic foods, you know already. So these are going to be things like your yogurt, your sauerkraut, your kimchi, your kefir, all of those foods that are really, really high in probiotics. A lot of our fruits and vegetables are also high in probiotics. So making sure you have those on board are going to help with those short chain fatty acids. We've talked about the antioxidants. You're going to be getting these from your cup of berries every day, which is going to help that mitochondria be nice and safe so that it can communicate with the DNA so that the DNA does not change shape and become a very abnormal cell. And then fiber, which we've talked about as well, again, getting it from your sweet potatoes, your apples, your beans, your green leafy vegetables. Now, in terms of just improving your overall health, the first thing is you've got to start with the gut. You got to get your gut health to where it needs to be. Once that's taken place, you're going to notice you're going to feel much better. So this was just a short little thing, an introduction to peptides, which have not just come out. These have been around for years. If you have any questions or you want to know more about what peptides we can use in you to help stimulate healing and repair and recovery in your body, please give our office a call, 812-290-2128, and I hope you have a lovely day.